Good afternoon. I'm Shannon Knutson, a nursing student with Indiana State University. This is a health education presentation discussing sexually transmitted diseases for our Community Health Course 444. First, we will discuss the learning objectives for this presentation. At the end of this presentation, you will know what is a sexually transmitted disease. We'll have you take a pretest to see how much you already know. What are some of the common bacterial and viral STDs? How are STDs spread? What are the ways in which STD transmissions can be prevented? How are STDs treated? I'll have you take a post-test to see how much you learned, and then we'll review the resources that were used to make this presentation and for you to further use for your research on this topic. So what is an STD? The term sexually transmitted disease is a virus, bacteria, fungus, or parasite that has infected a person's body via sexual contact. Sexually transmitted diseases, also known as sexually transmitted infections or STIs, are very common. Millions of new infections occur every year in the United States. STDs are passed from one person to another through sexual activity, including vaginal, oral, and anal sex. They can also be passed from one person to another through intimate physical contact, such as heavy petting, though this is not very common. STDs don't always cause symptoms or may only cause mild symptoms, so it is possible to have an infection and not even know it. Now I'll have you take a pretest. Pause the presentation and click on the link just below. When you're done, come back and we'll get started. Thank you for taking the pretest. Let's move on with the presentation now. So, what are some of the common bacterial and viral sexually transmitted diseases? There's bacterial vaginosis, chlamydia, gonorrhea, hepatitis, herpes, HIV/AIDS, human papillomavirus, HPV, pelvic inflammatory disease, PID, syphilis, and trichomonas. We are only going to discuss 3 of these infectious diseases in this presentation. The 3 we will discuss are in the top 5 of STDs spread in the U.S. But remember that you can use the available resources at the end if you would like to research the others. So let's talk about chlamydia. It is a common sexually transmitted disease that can be easily cured. If left untreated, chlamydia can make it difficult for a woman to get pregnant. Most people who have chlamydia don't know it, since the disease often has no symptoms. Next, we'll talk about gonorrhea. Anyone who is sexually active can get gonorrhea. Gonorrhea is a sexually transmitted disease that can infect both men and women. It can cause infections in the genitals, rectum, and throat. It is a very common infection, especially young people ages 15 to 24. Gonorrhea can cause very serious complications when not treated, but can be cured with the right medications. Gonorrhea has progressively developed resistance to antibiotic drugs prescribed for treatment. Last, we will discuss syphilis. Syphilis is another sexually transmitted disease that can have very serious complications when left untreated, but it is simple to cure with the right medication treatment. Syphilis is divided into stages: primary, secondary, latent, and tertiary. There are different signs and symptoms associated with each stage. You can get syphilis by direct contact with a syphilis sore during vaginal, anal, or oral sex. You can find sores on or around the penis, vagina, or anus, or in the rectum, on the lips, or in the mouth. Syphilis can be spread from an infected mother to her unborn baby. So, how are sexually transmitted diseases spread? They are spread by having oral, vaginal, or anal sex with the same-sex partner, so male to male, or partner of the opposite sex, male and females. We need to educate our community because a lot of people believe the only way sexually transmitted diseases can be spread is by having vaginal sex. So how can STDs be prevented? Take control and know the facts. Abstinence is the most reliable way to avoid infection, and that is just simply not to have sex. Vaccinations are safe and an effective way, and they are recommended ways to prevent hepatitis B and HPV. Reduce the number of sex partners. Reducing your number of partners can reduce your risk for STDs. It is still important that you and your partner get tested, and that you share your results with one another. Mutual monogamy, being in a long-term mutual monogamous relationship with an uninfected partner, is one of the most reliable ways to avoid STDs. But you must both be certain you are not infected with STDs. It is important to have an open and honest conversation with your partner. Use of condoms. Correct and consistent use of the male latex condom is highly effective in reducing STD transmission. Use a condom every time you have anal, vaginal, or oral sex. If you have latex allergies, synthetic non-latex condoms can be used, but it is important to note that these condoms have higher breakage rates than latex. Natural membrane condoms are not recommended for STD prevention. Last, we will discuss the evidence-based treatment plans for 3 sexually transmitted diseases that we had discussed earlier. For women, chlamydia, a urogenital infection, can be diagnosed by vaginal or cervical swabs or the first voided urine of the day. For men with suspected chlamydia, urethral infection can be diagnosed by testing first voided urine or a urethral swab. Antibiotic used to treat this is doxycycline, 100 milligrams orally 2 times a day for 7 days. If a patient is allergic, alternate treatment is azithromycin, 1 gram orally in a single dose, or levofloxacin, 500 milligrams orally once daily for 7 days. To determine if a patient has gonorrhea, your doctor will analyze a sample of cells. Samples can be collected by a urine test. This can help identify bacteria in your urethra. Swab of affected area. A swab of your throat, urethra, vagina, or rectum can collect bacteria that can be identified in a lab. For gonorrhea, the CDC recommends a single intramuscular dose of Rocephin, 500 milligrams once. Finally, syphilis. Syphilis can be diagnosed by testing samples of blood. Blood tests can confirm the presence of antibodies that the body produces to fight infection. The antibodies to the syphilis-causing bacteria remain in your body for years, so the test can be used to determine a current or past infection. Cerebral spinal fluid. If it is suspected that you have nervous system complications of syphilis, your doctor may also suggest collecting a sample of cerebrospinal fluid through a lumbar puncture. Treatment for syphilis, when diagnosed and treated in its early stages, syphilis is easy to cure. The preferred treatment at all stages is penicillin, an antibiotic medication that kills the organism that causes syphilis. If you're allergic to penicillin, your doctor may suggest another antibiotic or recommend penicillin desensitization. Now we'll have you take a post-test. Please pause the presentation and click on the link below. Return to the presentation when you're done. Thank you for taking the post-test. The resources used for this presentation was the cdc.gov STD, healthandhumanservices.gov. Thank you for watching my presentation, and remember, if you need further information regarding STDs or you want to do research on the other ones that were not covered in this presentation, please use credible sites as these for your information, as the ones used in this presentation will give you very credible information. Thank you.